If you're over 60 and you keep waking up with a headache, don't rush to panic. But don't automatically dismiss it either. A morning headache can be something simple: a poor night of sleep, not enough fluids, tension in the neck or jaw, a rough night after too much caffeine or alcohol. But when it keeps happening, morning after morning, it becomes more than a random ache. It becomes a pattern. And after 60, patterns are worth paying attention to. Because a headache that is already there when you open your eyes may be telling you something about what happened while you were asleep. Your breathing, your sleep quality, your blood pressure, your blood sugar, your hydration, your medications, even the way your jaw tightened through the night. This does not mean a morning headache points to one specific disease. It does not. A symptom is not a diagnosis, but it can be a clue. And the better you understand that clue, the better conversation you can have with your doctor. Many older adults make one of two mistakes with morning headaches. The first mistake is brushing it off as just aging. The second mistake is assuming the worst. Both can lead you in the wrong direction. Aging can affect sleep. It can affect thirst. It can make medications more complicated. It can make the body more sensitive to small changes. But pain that keeps returning should not be treated as meaningless just because you are older. At the same time, most headaches are not caused by something rare or catastrophic. Many morning headaches are related to more common issues: poor sleep, sleep apnea, dehydration, blood sugar changes, jaw clenching, medication patterns, sinus problems, or tension. The real question is not, what terrible thing is happening? The better question is, what pattern is my body showing me? Start with sleep. Sleep after 60 can change. Many people wake more often, sleep more lightly, or feel less refreshed in the morning. A night of broken sleep can leave the head feeling heavy, tight, foggy, or sore. But poor sleep is not always just poor sleep. Sometimes a morning headache may be linked to sleep apnea. Sleep apnea happens when breathing repeatedly pauses or becomes shallow during sleep. The person may not fully wake up, but the body is still being disturbed. Oxygen levels can change. Sleep can become fragmented. The nervous system can be stressed through the night. A person may snore loudly. They may wake up gasping or choking. They may wake with a dry mouth. They may feel tired during the day even after spending 7 or 8 hours in bed. If morning headaches come together with loud snoring, gasping, breathing pauses, or strong daytime sleepiness, it is worth asking a healthcare provider about sleep apnea. Not because every morning headache means sleep apnea, but because sleep apnea is one of those conditions people can live with for years without realizing it. Hydration is another piece of the puzzle. Many people over 60 do not feel thirst as strongly as they once did. Some drink less in the evening because they do not want to wake up to use the bathroom. Some take medications that affect fluid balance. By morning, the body may be a little dehydrated, and dehydration can sometimes contribute to headache, dizziness, dry mouth, fatigue, or darker urine. This does not mean water is a magic fix. It is not. But if your morning headache comes with a dry mouth, lightheadedness, or signs that you did not drink much the day before, hydration is something to notice. Then there is blood sugar. For people with diabetes, prediabetes, or irregular eating habits, blood sugar can shift overnight. Sometimes a person wakes up shaky, sweaty, weak, anxious, nauseated, dizzy, or unusually hungry. Sometimes they just wake up feeling off. A morning headache by itself does not prove a blood sugar problem. But if it appears with those other symptoms, especially in someone taking diabetes medication or insulin, it is worth discussing with a clinician. Blood pressure is another area where people often get confused. Many people believe high blood pressure always causes headaches. In reality, high blood pressure often has no symptoms at all. But very high blood pressure with symptoms can be urgent. A severe headache along with chest pain, shortness of breath, weakness, confusion, trouble speaking, or vision changes should not be ignored. So the balanced message is this: don't assume every morning headache is your blood pressure. But if the headache is severe, unusual, or comes with other symptoms, get medical advice promptly. Another often missed cause is jaw clenching or teeth grinding. Some people tighten their jaw through the night and have no idea they are doing it. They wake up with soreness in the jaw, pain around the temples, tooth sensitivity, or a tight feeling in the face. The headache may feel like pressure on the sides of the head. This can be easy to overlook because the habit happens while you are asleep. A dentist or healthcare provider may be able to see signs such as worn teeth or jaw tenderness. Medications also deserve attention. After 60, many people take more than one medication. Some can affect sleep. Some can affect hydration. Some can influence blood pressure or blood sugar. Some may list headache as a possible side effect. And pain relievers themselves can become part of the problem if they are used too often. This is sometimes called medication overuse headache or rebound headache. It can happen when headache medicine is taken frequently over time. The person takes medicine to get relief, but eventually the headache pattern can become more frequent. That does not mean you should stop your medication on your own. Never stop or change a prescribed medicine without medical guidance. But if you are reaching for headache medicine several times a week, or the headaches are becoming more common, it is worth bringing that pattern to your doctor or pharmacist. Sinus issues can also be involved for some people. Congestion, allergies, sinus inflammation, or pressure around the forehead and face can sometimes contribute to morning discomfort. But sinus headaches are also commonly misunderstood. Some headaches that feel like sinus pressure may actually be migraine or another type of headache. So if it keeps returning, it is better to have the pattern reviewed than to keep guessing. There is also one condition older adults should know about because it needs prompt attention. It is called giant cell arteritis. This is not the most common reason for a morning headache, but it matters because it usually affects people over 50 and can involve new headache, temple pain, scalp tenderness, jaw pain while chewing, or vision changes. If you are over 60 and develop a new kind of headache with pain around the temples, tenderness of the scalp, jaw pain when chewing, double vision, or vision loss, do not wait and see. Get medical care promptly. Again, the goal is not fear. The goal is awareness. A morning headache is not always serious, but some patterns should be taken seriously. Pay attention if the headache is new for you. Pay attention if it is getting stronger, lasting longer, or happening more often. Pay attention if it wakes you from sleep, or if it is already severe when you wake. Pay attention if it comes with confusion, weakness, numbness, trouble speaking, fainting, fever, stiff neck, or vision changes. Pay attention if it follows a fall or head injury. And pay attention if it comes with loud snoring, gasping, choking, daytime sleepiness, jaw pain, or temple tenderness. These details matter because they help separate a one-time headache from a pattern that needs evaluation. One practical step is to keep a simple headache record. Nothing complicated. Write down when it happened, where the pain was, how strong it felt, how you slept, whether you woke up during the night, whether you had alcohol, whether you felt dehydrated, what you ate the evening before, what medicines or supplements you took, and whether there were any other symptoms. A few notes over 2 or 3 weeks can sometimes reveal more than memory alone. You may notice the headaches come after poor sleep, or after nights when you drank very little, or after using pain relievers more often, or after waking up with a dry mouth, or after nights when someone says you snored heavily. That pattern can make your conversation with a healthcare provider much more useful. There are also general habits that support better mornings. Keep a steady sleep schedule when possible. Try not to treat sleep problems as something you simply have to tolerate because of age. Stay reasonably hydrated during the day, unless your doctor has told you to limit fluids. Eat balanced meals, especially if you have blood sugar concerns. Be cautious with alcohol close to bedtime because it can affect sleep quality and breathing during sleep. Do not keep increasing pain relievers without medical advice. And review your medications and supplements with a doctor or a pharmacist if the headaches are new, frequent, or changing. This is especially important with over-the-counter products. Many people assume that if something does not require a prescription, it cannot cause problems. But over-the-counter medications and supplements can still affect the body, especially when combined with other medicines. The safest approach is not to guess. The safest approach is to notice the pattern, write it down, and ask the right questions. You should talk to a healthcare professional if morning headaches are becoming frequent, worsening, or different from your usual headaches. You should seek urgent medical care if the headache is sudden and severe, if it feels like the worst headache of your life, if it comes with weakness, numbness, confusion, trouble speaking, chest pain, shortness of breath, fainting, fever, stiff neck, or vision changes. And if you develop a new headache after age 50, especially with temple pain, scalp tenderness, jaw pain while chewing, or vision symptoms, do not ignore it. A headache in the morning can feel like a small thing, just a dull ache before coffee, just pressure behind the eyes, just another rough start to the day. But if it keeps coming back, it deserves more respect than that. It may be your sleep, it may be your breathing at night, it may be hydration, it may be blood sugar, it may be jaw tension, it may be medication patterns, or it may be something your doctor needs to evaluate. The main lesson is simple. Do not diagnose yourself from one symptom, but do not dismiss a repeated pattern. After 60, your body often speaks quietly before it speaks loudly. A recurring morning headache may be one of those quiet signals. You do not need to be afraid of it. You just need to pay attention to it. And if it is new, worsening, severe, persistent, or coming with other symptoms, it is worth bringing to a qualified healthcare professional. Because taking a symptom seriously does not mean expecting the worst. It means giving your body the respect it has earned. If you want more calm, clear explanations about health after 60 and the body signals worth noticing, subscribe and keep learning with us.